Hi, I'm Bobby Joe. I'll be your nurse practitioner student today. Do I have your permission to record this?
Yep.
Your name and date of birth?
Rob Evans. My date of birth is November 3rd, 1971.
Okay, so if it's okay with you, I'll perform what's called a neurological exam on you, ask you a few questions, and then have you do a few tests.
Okay.
Okay, so what is today's date of date?
May 21st, 2019.
Okay, and where are you?
I'm at home.
Okay, where's that?
Greencastle, Indiana.
Okay, can you tell me about your first job?
Oh, I had a newspaper out.
Can you tell me who the president is currently?
Donald Trump.
And if you found a letter on the ground, what would you do with it?
I would return it to the person that it belonged to in whatever fashion was necessary to do so.
Okay, so I'm going to perform some tests on you now. I'm going to have you close one nostril for me and smell me. We're pretending like it's coffee.
It smells like coffee.
And then I would perform the test on the other side as well. That tests cranial nerve number 1. Cranial nerve number 2 is optic. So first I'm going to have you read this, and the Snellen chart, which is 6 feet away. Can you tell me what the lowest line is? Cover one eye for me and tell me what the lowest line is that you can see.
LTFP in?
No.
Yeah, okay.
So now do the other eye.
LTFP M is in, or H. M?
No, it's H. Okay,
H.
now with both eyes.
LTF, or LTP, PH, FPH, LTFPH.
Do you mind if I write some stuff down?
No, go right ahead.
Okay. And then I'm going to have you... Okay. So now I'm still testing optic, but I'm also going to have your eyes without moving your head, follow my finger. Okay, testing for convergence.
Excuse me. Okay. Sorry.
I'm fine. Okay. This is testing for ocular motor number 4, trochlear. This is testing for abducens. And this is testing for trochlear. Okay. Now is it okay if I shine a light in your eyes?
Sure.
Okay. Looking for the red reflex, I'm going to perform a fundoscope. Obviously, I would turn the light off for this, and then I would do the same thing on the other side. I'm looking at the retina, the optic disc, and the vessels, and then I'm using the same eye that I'm looking at. I have already tested your fields of vision. I'm going to shine another light in your eyes. And just watch my finger, please. Okay. And then if you can close one eye and then open it. Okay, that's testing for nystagmus. It's not present. I've already tested for trochlear. Now I'm going to test for trigeminal. testing of the forehead, the cheek, and the jaw. So I just need you to tell me if you feel dull or sharp. Please close your eyes.
Dull. Sharp. Dull. Sharp. Dull. Sharp. Dull.
Okay, that's intact. And then, can you open your jaw for me? Okay. It's the motor and sensory portion. The motor was me opening his jaw against resistance, and the sensory portion was me checking for soft or dull up on his forehead, cheek, and jaw. I've already tested for abducence. Can you wrinkle your facial muscles for me? Okay, can you smile for me? Okay, can you frown? Frown.
I'm a happy guy. That's about as good as you're gonna get
Can
with
you
the
puff
frown.
them? Can you puff your cheeks out? Okay, thank you. Okay, I'm gonna close one ear and whisper a word in your ear, and I just need you to tell me what it is.
Sure. I couldn't hear. Dog.
And then I'm gonna do the same with the other ear. That's the whisper test, and then we're gonna do the Weber and Ryan test. So I'm gonna, and this is number 7 acoustic. Do you want to hear it?
Do what now? I hear it. I don't hear it. I hear it.
Has it stopped?
No. Now it has.
Tell me it stops, Ryan, please.
Stopped.
Can you hear that?
Yep.
Okay. Air conduction is greater than bone conduction. Then we're going to test for 9 and 10, glossopharyngeal and the vagus cranial nerves. I'm going to shine a light in your mouth, and I need you to stick your tongue out and say ah.
Ah.
Okay, we're testing to see if the uvula is moving with the ah. And then I also need you to swallow for me, please. Okay, and part of this is also the gag reflex. So next we move on to the spinal accessory, or the number 11. The sternocleidomastoid is what I'm going to test now. I just need you to push against my, okay, and then turn against that. And then I'm going to test your trapezius strength. Can you shrug your shoulders for me? Okay. And then hypoglossal, which is number 12. Can you stick your tongue out? Okay, his tongue is midline. Can you push against the left cheek? And can you push against the right? Okay. And his strength is present with his tongue. So next, I'm going to have you walk, please, from there. Just a few steps. Okay, steady gait. This is testing cerebellum function. Now if you'll turn back around and walk heel to toe. Perfect. Now if you'll walk back to me on your toes. Okay, and then if you can turn around and walk on your heels. Perfect. Thank you very much. And you can have a seat. Actually, I lied. I'm going to have you stand up one more time for the Romberg test. Just close your eyes for me and just stand at attention. Okay, he is not shifting anywhere. And then I'm going to have you put your hands out forward, eyes still closed. And then I'm going to push him, relax, and then I'm going to push him down Okay, and then I want you to see where this is pronator drift. This is to see how far up you move everything. I want you to put them back in the same position. Put them back up. When I push down, just push them, but let them go back up.
Gotcha.
Okay, no pronator drift, so that's negative. So now you can have a seat. Okay, what I'd like you to do for me now is to take your hands and do like I'm doing. Do it on your, if you would, please. And then just back and forth. Okay, rapid alternating movements is present. Okay, you can stop. Okay, and then just an extra move to make sure everything was good.
Yeah.
Okay. Okay. So what I need you to do now is close your eyes and tell me if I'm moving your joint up or down.
Up, down, up, down,
And then I'm going to do your toe.
up, down.
Okay, and then I would do his other foot. Now we're going to do what's called 2-point discrimination. So I need you to just tell me if you feel 1 or 2.
1. Well, that one felt like 2, kind of.
It was.
2. 1. 2. 1. 2. 1.
Okay. And then I'm gonna
2. 1. 1. 2. 1. 2.
Okay. He felt it. I performed it on his upper as well as his lower. Okay, if you'll close your eyes for me and put out your hand. Just one, please. Okay, I'm going to put this in your hand and I just need you to tell me what it is.
It's kind of feels like an E-pin, but it's round and cylindrical.
You're right. Thank you. And I would do the same on the other side. Now I'm going to, I just need you to tell me if these are sharp or dull.
Okay.
So I'm going to do
Dull. Sharp. Sharp. Dull. Sharp. Dull.
okay, and I would perform it on the other side as well. Now we're going to do his lower. I need to.
Dull. Sharp. Dull. Sharp. Sharp. Dull. Sharp. Dull.
Okay. Superficial tactile and pain sensation is intact. Okay, now I just need you to tell me if you feel this, if you'll stick one hand out.
Yes.
Okay, and then I'm going to do the same thing to your foot here.
Yes.
Okay. Vibration sense is present and intact. I would perform the same on the other side. So now we're going to move on to his motor strength. I'm going to be looking at your deltoids, triceps, and biceps. So if I may, okay, just let your arm relax. Okay. I'm going to push against you if you can just resist. Try and raise your arm. Okay. Now I'm going to do the same. pull down on your arm. Testing his tricep, pull up, testing his bicep. Okay, stop. And then I would do the same on the other side and compare them. Now we're going to do his lower extremities. If you can unwrap your feet for me, please. Okay, push up. Okay, pull down. Okay, now if you'll lay down for me, please. I would perform the same test on the other side as well. Okay, and then if you can put your knees up for me. And then this is testing for the hip abduction and hip adduction. So, pull your legs apart for me, or your knees. Okay, I'm going to push them in, you try and resist. This is adduction. And then put them together for me. And I'm going to try and pull them away. And then please let me know. Okay, and abduction. Okay, have this. And then sit back up for me, please. Okay, so now we're going to do your deep tendon reflexes. I just need your... May or may not find any with this patient. Just relax. Relax. Okay, but the idea is that you should hit here and see a little movement there. So that was the biceps. That was the triceps. Okay, and then I would do the same on the other side. And then I'm testing his patellar. Okay, and then I would do the same on the other side as well. And then I'm going to check his Achilles response, if you can pull up your foot. And that's directly behind the Achilles, on the Achilles tendon. Okay, and he had a jerk in his feet. I would do that on the other side as well. And then I'm going to test his superficial reflex. We'll see if this works. It has not before on him. Okay, and he flared his toes, or not flared, but flexed his toes. Okay, so then that ends our test today. Do you have any questions for me?
Yeah.
Yes.
My nose is running.
Oh, please don't do this for me on this. Okay.
I think I have a head cold.
Well, we can talk about that after we shoot the
Okay.
video off, okay?
Okay.
Thank you, sir.